Well, fresh hope in the fight against COVID-19 this morning, with Australian scientists launching the first testing on potential coronavirus vaccines.
Sounds good, doesn't it? In what's being described as a critical milestone, the trials are expected to take around 3 months at CSIRO's facility in Geelong. And Dr Rob Grenfell is the CSIRO Health Director and joins us now from Melbourne. Doctor, good morning to you. Thank you so much for your time. I was so looking forward to talking to you. What will these tests involve?
So these tests will actually involve the candidates that we have received from the CEPI, which is the Coalition for Epidemic Preparedness and Innovation, and approved by the WHO for testing. We'll be testing these on our models. We actually have a ferret model that we've been working on since January to analyse the effectiveness of vaccines. Over that period of time, we immunise, then we actually expose to the virus, and then we work out how effective those vaccine candidates have been at working, so they then can move on to human trials if they work.
What do you mean you immunise? Just talk us through that process. You immunise with what first?
So we have been presented with 2 samples that the WHO and CEPI selected as first entrants into this test phase. So we immunise our test animals, and we immunise them with these 2 samples, and then after about a 3-week period, we then expose them to the virus, and we look at how those vaccines work and what happens.
So the 2 vaccines you're looking at, I mean, I think there's one from the US and there's one from the UK that you're looking at. There's also something locally, so there's the 3. I mean, just how do you balance this? I mean, the whole world is working so quickly to find a vaccine. We keep being told that, 18 months or so away. How do you make sure that, you're working safely as well as quickly?
Look, safety is paramount. In this type of work, the quality systems that we have to adhere to are the highest that you possibly can. Now, that's very important because we do not want vaccines or vaccine candidates that are in fact actually unsafe to proceed on to human trials. So that's where this work is vital work, so that 1, we can demonstrate they work, and 2, we can demonstrate that they don't cause harm.
I note with interest last night Greg Hunt was on A Current Affair and he was talking about the fact that they're rushing in this malaria vaccine. I can't recall the name, it's hydrochloro something or other, and perhaps you can help me out with that. But that is for the treatment of all this. Realistically, how far away are we from a vaccine that is going to be effective in a wide scale across the community?
So, look, I'll come back to the chloroquine question, Carl, but the vaccine, we're still around about 18 months total in the process, but we've in fact shortened the time period by, I reckon, around about a month or 2. Normally it takes about a year to 2 to actually get to the point where we've got to. So to give you an idea, we've done this from late January to now to actually get to this stage. And we also understand that a lot of the studies within the margins of safety and quality are in fact actually also being accelerated. So there's multi-trials with these candidates going on globally as we speak. So that's happening at that level. So, we may, if we see human trials, phase 1 trials, with, say, one of the candidates they're touting, they may in fact be looking at late April, early May was the last thing we heard, which is ambitious. But if they move into that phase, then phase 2, Carl, this could be an incredible situation where we do have them much earlier than that initial 18 months that everyone's been talking about. Now, let's come back to the chloroquine question. Chloroquine is an old anti-malarial drug that we've used before. There were some studies that came out of China suggesting that it may, in fact, actually reduce the damage caused by the virus or even the chance of catching the virus. Now, I'm aware that there are a couple of studies now that have commenced in Australia to look at how they maybe work. One of the well-controlled studies that I am aware of is being done by the Australian Malarial and Infectious Diseases Centre up there in Townsville, and I know that they have set up a very well-controlled study to look at whether or not this works. Wow. So it's not a reason to go out and buy that drug because it's not proven yet.
Yeah, right. So, I mean, that is interesting, isn't it, that we're probably closer to finding a treatment, obviously, than when we are to a vaccine. But while we've got you here this morning, I just wanted to ask too, because we're hearing that the flu shot is going to be in short supply this year. How concerning is that?
Look, as a public health doctor, we've been part of the urging of everyone, especially those at high risk, to get a flu injection every year, because the more people that have it, the less likely we are to have the annual flu outbreaks. Now, there is potential that we will still have a surge in cases during the flu season later this year. So it's vital that as many people as possible can in fact actually get a flu injection. Now, I know that means a surge on supply of those. Most importantly, those vulnerable people need to get their flu shot this year, and they need to do that as soon as they can get supply of that. For the rest of us, it certainly is strongly advised that we also achieve getting flu vaccine this year.
The takeout from all of that, we're moving closer, hopefully closer towards a vaccine. I could talk to you all day, Rob. I find it all very fascinating. And thank you so much for your time. Appreciate it.